Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at assessing and addressing the problem of pain and distress during wound care procedures in pediatric patients with burns. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is about perceived utilization of leadership styles among nurses. It was written by Gachet et al. And published in the journal Risk Management and Healthcare Policy in 2023. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the second page of the article just below the abstract. Leadership is the process of a senior person motivating a team, junior, or follower to achieve organizational goals. There are many different types of leadership styles that are usually categorized into three main types: transformational, transactional, and laissez-faire. Transformational leadership influences followers towards achieving goals by first changing their beliefs, values, and needs. Transactional leadership directs followers using rewards and punishment, while the laissez-faire style has little or no guidance from the leader and gives employees the freedom to work independently. Nursing leadership style has been known to influence job satisfaction, job performance, and quality of services provided. It has also been associated with nurses' retention in organizations. Nurses' working conditions are challenging due to staff shortages, staff burnout, and poor leadership in retaining and attracting nurses. These factors are especially pertinent in African settings due to nursing shortages, healthcare system failures, and ineffective utilization of leadership style. Previous research has shown that transformational leadership in nursing brings positive outcomes among staff and leads to high-quality nursing care and nurse job satisfaction. There is a lack of published articles in Ethiopia regarding the perceived utilization of leadership style among nurses. Therefore, the aim of their research was to assess the perceived utilization of leadership style among nurses at Jimmertown public health facilities in Ethiopia. We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the second page of the article, right after the introduction. The study followed a cross-sectional design. A cross-sectional study collects data from a population at a single point in time. Data was collected for 1 month from 16 August to 16 September of 2021. The research team conducted a statistical test to determine the correct sample size. A large enough sample increases the statistical power of a study, which means a higher precision in estimations and a smaller margin for error. All nurses employed within Jimmertown public health facilities during and for at least 6 months prior to the study were eligible to participate. A simple random sampling technique was used to select possible participants. Data was collected through a self-administered questionnaire with 6 components, which included demographic questions, multifactorial leadership questionnaire, grouped under domains of the 3 leadership styles: transformational, transactional, and laissez-faire, organizational commitment, job-related stress, innovative work behavior, and leadership practice. The questionnaire was pre-tested on 21 nurses and checked for validity and reliability. This means that a questionnaire repeatedly measures what it is designed to measure. Data collectors consisted of 3 BSc-trained midwives, supervised by a trained health officer who facilitated data collection, none of whom were employed by the Jimmertown public health facilities. Moving on to the analysis and results, which can be found on the third page of the article. Data were checked for completeness and consistency and entered into SPSS, a statistical software package for managing and analyzing data. Descriptive statistics were presented in means, or averages, frequencies, number of times, and percentages. A statistical test called linear regression was performed to determine which candidate variables were associated with perceived leadership styles. Linear regression is a statistical test that involves an outcome. In this study, nurses perceived utilization of leadership style and a number of possible associated factors to determine which factors are most associated with the outcome. The researchers work with a statistician to enter all the possible associated factors into the SPSS software package to determine the result. So what were the results? The article presents the results of this research in words and tables. Table 1 on page 4 to 6 of the article presents the demographic data of the 403 participants. Results show that nurses perceive their head nurses to commonly use transformational leadership style. They sometimes use transactional leadership and a laissez-faire leadership style once in a while. When all the potential factors that could be associated with nurses' perceived leadership style were entered into the linear regression model, 5 factors were identified as statistically significant. This means that they were associated with perceived leadership more than by chance. Positive factors associated with nurses' perception of their head nurses' leadership style were being female, having a positive organizational commitment, and innovative work behavior. Negative factors associated with perceived organizational style were no training on leadership and job-related stress. Which brings us to the conclusion. The study reveals that the leadership style perceived to be the most commonly used by head nurses in the Germantown public health facilities is transformational leadership. Effective and balanced use of leadership style requires training on leadership, organizational commitment, and innovative work behavior. Implications for practice and policy. The author suggested that nurses be trained in various leadership styles. They also recommend that a transformational leadership approach is key to achieving organizational goals and increased nurse productivity. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you have done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.